Owings, the Kilted Chiropractor serving Grand Rapids, Michigan as Advanced Family Chiropractic Center. If you're suffering from stress, body pain, fatigue, poor sleep, and weight gain issues, I want you to find me so we can work on it together and you can go play. Hello everyone, Dr. John here with the Kilted Chiropractor. Make sure you take the time to subscribe to our channel and like our videos. Today I have a new patient, first time in, Mason.
Yeah.
Talk to me, what happened?
So, about yesterday, I'm a football player. I've been a football player for about 7 years.
Okay.
It's my junior year in high school, and we were lifting yesterday before practice, and I think I was doing some sort of lift, or I maybe jerked too hard.
Okay.
I was doing a higher set than I normally do.
What kind of lifting were you doing? What were you lifting? Chest, backs?
Yeah, it was like a chest and shoulder row.
Okay. Right.
It was a heavy weight.
How much were you lifting, do you recall?
200,
Okay.
I think.
Now you're scaring me.
Well, I've been doing it for 7 years. So.
Sure, I understand.
So, and then.
So you're doing a row? Like
yeah, it was.
Bent over rows?
It was a bent over.
Oh, okay,
this kind of motion right
Yeah.
here. And I got home and I started noticing just this like stabbing kind of pain across, like horizontally across my whole back, kind of right underneath my shoulder blades.
Okay.
And like rotation in my neck. Like I was trying to drive and check through intersections, and just past here and past here, it just brings a lot of pain, and down.
Okay.
Brings a lot of
So we've got mid-back pain, pain in the neck with rotation, pain with flexion looking down. We're going to assess all those. Have you, and that was from weightlifting just yesterday.
Yeah.
Any previous history of injuries in football?
Not so much clear injuries, but I do see a chiropractor sort of regularly for just chronic back pain. It runs my whole family. My grandpa, my dad, we've all seen kind of the same guy for the same areas of pain.
Okay.
Kind of like the upper right shoulder and the lower back towards kind of like the right hip area.
Okay.
We all have the same kind of problems. So I've been seeing somebody for that kind of frequently.
Right.
But this is like a whole new thing. I never experienced it that much in my upper areas.
Well, let's find out what's going on. And then how I work is going to be a little different than maybe what you're used to. So we'll assess and figure out what's happening, okay?
All right.
Holy crap. Actually, is it okay to take your shirt off?
Yeah, that's
Let's pop that shirt.
Yeah.
Might as well.
Do you need to get your insulin pump off, or?
No, I can leave that on.
Okay,
We're not going to mess with that.
Yeah.
All right. Let's see here. I'm going to have you turn your head and just tell me if you ever get some pain there. Okay, where are you feeling it?
It kind of
here?
It kind of just actually tugs kind of on the middle of my spine. That's kind of where it feels.
Can you just down in here you're feeling it?
Yeah.
Okay, there's your coupled motion, how things kind of talk to each other. So how strong, if 10 is the worst and 0 is pain-free, what's the strength of that pain? So I bring this, what does this bite to?
Like a 5 or 6.
5, 6. Okay, let's turn the head to this side. Do you get pain again?
Yeah.
Does it stay as strong, 5 or 6?
I'd say it's less on that side.
Less on that side. If I tilt your head straight back, what are you feeling?
Nothing. It's just a little tight right there.
You've got a limited range of motion on extension too. Is this as far as you go back? If I go harder, can you go any further? Feeling it?
Yeah.
Or is it increasing in pain as you go back?
Yes.
Okay, we'll go there. We're not gonna force it. Can you demonstrate the motion you were doing on the, just go ahead and stand up
Okay.
and show me the motion. Were you doing bent over rows or?
Yeah, it was right here and
Yeah.
then that.
And you're doing that and you
Yeah.
feel it and you got it right through there. I got
Yeah.
what's going on, okay. Plus you're a football player, so.
Yeah.
Which means you're beating people up. It's an excellent attitude to have. No, be nice about it though. Just kidding. All right, any tenderness up here? I'm just touching these muscles.
Yeah, it's kind of tender.
Kind of tender. How about over here? And these upper traps are really tight over here.
Yeah.
Dang. All right. Now with football, any history of lower back pain, sir?
Not much.
Not much. All right, so what I'm gonna do, are you getting any numbness and tingling down your arms? Any sensation like that happening?
Not in my arms, but I haven't been able to feel like my right foot for like 5 hours.
Okay, so you've got a right foot problem and you haven't feeling your foot problem.
Yeah, it feels like it's asleep, but it hasn't gone away.
He's just gonna keep adding stuff for me to work on, isn't he?
I know.
Well, this is gonna turn into a long visit. That's okay though. All right, you're a big guy, so let's do the neurology. Let's see what the nervous system tells us. So you're gonna bring the arm up. We also have another problem. And the shoulder is not moving. That's it. That I do not like. It gets a little higher on this one. Feel it crunching in there? Whoa. You're gonna make me work. That's okay. But this one is a dead end right here. Okay, do you feel that?
Yeah.
So the goal is to fix this too. So we have a shoulder, left shoulder problem. Hold that arm right there for me. Don't let me push it down. How much were you working out? How much were you lifting? Don't let me push it down. Hold tight. Look at that. I can totally move this arm. That's how weak you really are. I'm gonna make it better though, okay? So that's the goal. In that chiropractic clinic, in my clinic here, I'm gonna assess the neurology. I'm gonna find what's weak. The weakness tells us where to look.
Okay.
Then we're gonna make the changes that we're gonna make. And what we wanna do is see if it gets stronger. Now when they don't change and they stay weak, we got a different problem. So I expect change from a young guy like this. Bring the arm down. You know what a tricep extension is, so go do it. Push as hard as you can. And don't let me push the arm down. Now watch. Got no tone. Hold tight. See that? The neurology firing there. Push as hard as you can. Hard as you can. There's nothing on those either. How much do you like to do your tricep extensions?
40.
Yeah. So I like to see if you'll get stronger as you're under chiropractic care done correctly. Most doctors will stop one adjustment. You're gonna see me recheck and recheck.
Okay.
Grip, give me some power. Look at this one. This is your grip strength. And I got you. You can't even hold that. Think we should fix those?
Yes.
So I want you to see this. Feel the tone on this one? But feel the tone on this one. I can peel it. Paint fingers like that. Lock them in tight. Don't let me peel the fingers. Try again. Lock them. Lock them. So we got a little bit more tone here. Can you see that? A little bit. Hold tight. Strong as you can. But go over here. Hold as you can. And I don't have to try, this peels them. So we want to see if we can overall get an increase in nerves, the tone of those firing, I don't want to say that. We want that nervous system to fire correctly, get those muscles to react correctly for power and strength. Flat on your back. Since she was doing leg work, I'm also going to see, he's got big legs. Let's just check the power of different nerve roots there. Bend the knee in, hold real tight, I'm going to push straight out. Strongest muscles here. It's recruiting that, get them down. Okay. Watch what happens when we get this done. Hold tight for me. See that?
Yeah.
Can't even hold it. That's okay though. I'm gonna check some of your core strength here.
Okay.
This is a little bit complicated. Let your head rest. I'm gonna drop this flat. I'm gonna take your legs out this way, okay? I'm gonna try to pull them back.
Gotcha.
Don't let me, okay? So hold tight. It's got nothing. I can pull them over. Let's check over here. Hold tight. So that side is firing, but this side, hold tight, is not. I can get them over. Feel the difference in power?
Yeah.
Yeah. We've got a few things to fix. All right, flip over, face down for me. I got a weak shoulder on the left. It doesn't have good motion on that left shoulder. Pain in the neck. With weaknesses in the motor and the extremities, weaknesses in the lower extremity, with numbness in his right foot. Is that correct? Right foot numbness?
Yep.
So let's see what we can undo on our first visit, just getting this body relaxed and change. This is not going to be fixed and, it's not one to fit. This is an injury. First thing we're going to do is loosen your body up, okay? If anything becomes too uncomfortable, holler at me. There's no prize for toughening it out. This is not what this is about. Healing the body is a general process, but we do got to work. Some things are going to be sore. Here we go.
Yeah, I've just had not very good luck with football in the past year or so.
Said a couple of fractures.
I had a scaphoid break in my right hand,
Okay.
and then I had a fibula break in my left leg.
You're just an aggressive person.
With a yeah, I took a bad hit right to the side of the knee,
Mm-hmm.
and ever since then I've kind of had just a lot of knee pain. doing singular,
Okay, what knee is giving you a problem?
the left.
So you got a left knee problem as well. How old are you?
I'm 16.
16 and almost wants a permanent impairment rating. Jesus. Okay, have you ever thought about badminton? Swimming. It's a hell of a lot.
Yeah.
Ping pong, I mean, come
As
on.
a mom, I
Let's just go easy. I tell that, and I trained martial arts and have 3 black belts for years. Talking about aggressive sports. But I did it with honor and respect.
right, exactly.
My coach the other day told me that as a lineman, I shouldn't expect to keep most of my fingers because in college he broke 8 of his 10.
Oh,
Yeah.
well. I'm not sure how to respond to that. I was not a football player. I just know in martial arts we teach the same thing. If you're not careful, you will break fingers, and so you learn to keep things closed correctly and not extend with your fingers because that's what breaks them. And I'm not sure, I'm not a football player, so I don't know that you break them because of bad habits and improper technique. That's not my skill set. I would like to see you not break your fingers and keep them attached.
Yeah.
I found that people are happier when.
I've always had a pretty tense upper body when it comes to just muscle tenseness, I guess.
Well, you're an athlete and you're using a lot of your muscles, but it's one thing to have chiropractic care that, you know, helps with musculoskeletal system. But when I have really intense athletes like you need muscle work as well, not just skeletal work, you need muscle balancing work as well. And if you're planning on going to college and playing some college ball too, you're gonna have to really take good care of yourself. It does matter. And a functional peak performance athlete is very mindful of eating well, drinking well. In college does not mean beer, it means water. So eating well, you know, drinking well, eating well, playing well with the athlete, but getting good rest, not stressing your body out. And then you can stay an athlete for a long time. But random crazy behavior and being an athlete really doesn't, it just gets you injured and there's no payoff. But my job is not to tell you what to do, but to be a guide and you do whatever you want. We got some knots in here.
Yeah.
I want this arm.
I try to massage it. It's
Take this arm, put it behind your back, just like that. You're gonna see some of the oil there, but hang in there.
Yeah, I've always had pretty poor flexibility kind of all around.
Okay. Well, I'll see what I can fix. You definitely got something in the shoulder here I do not like. But it may take a few visits to unwind that out of there, but I think you got it anchored in your mind what it feels like, so let's just see what happens when we're done. How's that sound?
Mm-hmm.
Now you were feeling most of your pain right through here, right?
Yeah, and kind of horizontally under the shoulder blades as well.
Okay. I'm gonna have you brought that arm down. I'm gonna check this muscle right in here. How's that feel right in there?
Oh, not bad. It's a little tight.
Not bad. Okay, I'll take it. A little bit of the lat comes up under here. Getting really red right through there. So that one right there. What I'm doing is there's a sling relationship between the latissimus dorsi, the tissue that connects here, and the glute to the opposite side. So I'm just kind of waking these pathways up a little bit here. I'm just talking to them. Do the other side now here. Go around the insulin pump. You're type 1 diabetic then?
Yes.
Okay. Take this arm behind your back. There's a big knot over here too. Damn. Set that back down. Okay, that's not bad. Okay, I'm gonna clean this back. Woo! Okay, now. Alright, let's see how his body talks. Put your arms on your back. I'm just going to start releasing both of them here. I just want to release this middle back first to see how your body talks to me. He's just... I'm going to do one other thing. I don't like the feel. I'm just going to preload these joints a little bit for you, okay? And just loosen you up a little bit more. Probably stuff you haven't seen yet. All right, nice and deep breath in, all out. I'm gonna go for these ribs here, just see what your body will let go. Deep breath here, all out. Nope. Little tiny one there. All right, deep breath here. Good. Over here. One more. Just want to see here. Nope, nothing left. Okay. All right, I'm gonna have you flip over for me, sir. All right. Oh. How's that? Let's do part 2. Now I'm gonna do the traction adjustments on you.
All right.
I'm gonna go a little bit deeper. We're gonna do this in a couple of parts. What's gonna happen is I'm not gonna adjust right away. I'm gonna have you breathe. I'm just gonna gently traction spine a little bit and then I'll adjust. So head up for me. Head down. We're gonna move the hair out of the way. Let it go, drop all the way down now. Perfect. Yeah, I gotta get the hair out of there. Perfect. All right. We're gonna bring this to tension softly. Take a deep breath. All the way out. You're gonna feel it pull. I want you just to breathe. And I'm just gonna pulse. Nice and easy. You just keep breathing. Good, let it relax. I kinda like to load and unload very gently. Take a deep breath again. And all the way out. I'm gonna load the tissue. Just keep breathing. Good. And we're gonna relax. Now I'm gonna adjust this time. Everything good? You feel comfortable?
Mm-hmm.
Okay, take a deep breath. All the way out. How'd that feel?
Good.
More move?
Mm-hmm.
I liked it. It did very well. Now, I'm gonna check that shoulder. I wanna see if the release cleared some of that. So go ahead and sit up for me and face the wall there. Now, just in a neutral position, let's just see if that helped the shoulder. Did that help the shoulder?
I feel it definitely looks like it does.
Yeah, that's a huge change. So this one's even moving better. Let's check the fire in that muscle. Hold tight right there for me. Hold tight. What do you think? Stronger?
Yeah.
Hold tight for me. Stronger? I think so too. Not 100% satisfied on the shoulder though. It's better for sure.
Yeah.
Take this down. Hold tight. It's a little better. Do this one right here. Hold tight. A little better. Let's do the triceps on that one. Push as hard as you can down. That's definitely holding. Push hard as you can. Problem right there. See that? We're not done yet. On your back, sir. You have to do a different technique. Head up, head down. That was the left side, wasn't it? My brain almost forgot for a second.
Yes.
Okay, here we go. Different angle. Take a deep breath in. All the way out.
Oh. Ooh.
For me. You feel that one move?
That one hurt a little bit.
Yeah, it did. It's done. Bring it up. Bring it down. Push. But look.
Oh, wow.
It's a little power. Bring it up. I like that. Better. On your back though. I'm gonna just. And once again, the job is not to reef on stuff. It's just to gently. A little bit more. I'm such a big dude. I gotta get anything work. So I'm just gonna kind of. There we go. Get this here. There's the, there it is. Feel that in there?
Mm-hmm.
Is that tender?
Mm-hmm.
Yeah, the AC joint. They take a hit. Sometimes that clavicle won't glide in that AC chromoclavicular joint very well. So I just like to kind of just gently work it around. Oh. Sit up for me. I think they just slid in. Turn around. Let's check it again. What do you think? That's definitely better.
Mm-hmm.
Now hold the arm there. Hold tight. Nice. On your back. Now we're gonna fix the other stuff. I want you to push right here, both hands. I'm gonna walk you through it. Just right in the center, you're gonna push straight in, do not let go. Then we have this leg here. Take a deep breath. Let the air all the way out, let the leg relax. Let the leg relax. Oh, there it moved. Let the leg relax. Deep breath in and push. Nice.
That felt really good.
That moved too. Hold the leg. What do you think? Better?
Yeah.
I think so. That was nice.
You don't even notice until you try to do the push thing.
Yeah, now you got full power in there. Scoot back up just a little bit. And what I'm not liking is the numbness in that right foot. So I'm gonna drop these shoes off real quick.
That's alright. I don't have socks on now.
That's okay.
Oh my god.
We'll fumigate.
I hope they don't smell. I hope they don't smell.
Well, feet take a feet take a hard pounding of football players, you know?
Yeah.
It's a reality. I totally understand. Actually,
Just found out on Friday.
that's interesting to know. Hold that foot towards your head. Hold tight for me. Try again. And all 5 is collapsing on me. Hold this one in, hold tight. See how that one holds?
Yeah.
But this one, I load it. Boom. Okay. Actually, while we're here, we'll go ahead and do toes. All right. Now you're gonna help me fix this L5.
All right.
You're gonna push right there. And you have this leg and let it relax. Take a deep breath. Let it all out and push in. That move? Felt it.
Yeah.
Push that toe up. Hold tight for me. I'm gonna load it. Better?
Yeah.
Walk. Come on up. Walk around for a second. We're not done yet. Take a deep breath. How's your body feeling?
Different.
Different? Okay.
Still some like with
Still
the,
some there?
with the down and feel it in the back, but
Okay. You do have some muscle stuff going on.
yeah.
That's gonna take me a little bit of soft tissue. I wanna see if you can just feel less pain stuff. Face from the side here.
Like
Yeah, lay on your side. Perfect. Still gonna just do another quick check on some other stuff. Let me get this down here. Put that rest. Oh yeah. What's that? You're a champion. Doing good, sir. Oh goodness. There we go. On your back. Just got one muscle group we gotta check again.
Okay.
So center yourself up here. I'm gonna lower this all the way down. Go back up. Remember this other one was weak over here?
Yeah.
And I wanna make sure that you're strong going back out to play. So bring it to sideways, hold tight. That's definitely stronger. Let's make sure these stayed when you walked. Hold tight for me. That's stronger. Hold tight from here, hold tight. That's strong. So let's finish up the neck. One more thing, I'm gonna have you face the wall there. I'm gonna do a little bit light range of motion adjusting on it, and then we'll get you rescheduled for a follow-up. So what I want you to do, we're gonna do, and you're gonna turn your head to the left here. He's got this long hair, it's not that.
I'm gonna wear a ponytail myself.
Oh, that's okay. My son, I got a 14-year-old, 15-year-old hairs all the way down here. Like, I never did. Right here. I still can't get him to wear kilts though. I'm not gonna do that. People laugh. I'm like, no, they don't. Back to center. Look down for me. I'll turn it to the left and look down. Then gently back the other way. Look down. Back to center. And then a little bit, I'm gonna have you tilt it back. Just gentle range of motion. Good here. All right, now let's just see what kind of little improvement we can get. So turn your head neutral to the right. More pain, less pain.
Less pain than before.
And over here, less pain.
Yeah, definitely less pain.
Nice. Let's tilt it back. Tell me when you start having
Yeah,
pain.
right there.
Okay, we still have a hunk. Hey, we've got some work to do back here. And that's okay, I understand that. You're feeling it right up here?
Yeah, it kind of like goes from there and shoots down just the middle.
I'm gonna do one more thing because I am a perfectionist. So, let's do a bilateral T1. Because every time he lifts back, he still gets a pinch right at the base of that neck. Yeah, so my associate's gonna hold for me. Take a deep breath. Let your whole body relax here. Any movement? Come on up. Switch that way. To the way. Now very careful, let's take that neck back. Let's just see if it's less or more.
It's less. Yeah.
Getting less?
Uh-huh.
All right, so I know the hot spots we're gonna keep working, but we definitely got movement out of it and it improved it. All right, I always say, go play. But you, it's football, so it's time to go play. Okay. Carefully.
So anything I maybe shouldn't do at practice today?
Don't fight with anybody,
Okay.
and don't swear.
Gotcha.
Have fun.